So you're dealing with neck pain. Maybe it's just a crick in the neck that you woke up with, or it could be something you've been dealing with for years and you're finally ready to get it taken care of. At Movement Cube, we're going to take you through a thorough exam to make sure where the pain is actually coming from, and then we're usually going to treat this from 3 different angles. A joint perspective is going to use something like a chiropractic adjustment to help those joints move the way that they should. Now, if this is something that you don't need based off our exam, or you're just not comfortable with an actual chiropractic adjustment, there's a lot of different ways we can make that joint move better, and it could be as simple as a gentle mobilization. Once we've cleared out the joint, we need to look at the soft tissue to see if there's any tight or tense muscles that are causing pain. There could be trigger points or knots that actually refer down the arm or to the other areas. And there's a million different ways we can treat this, from instrument-assisted soft tissue, needling, my hands, laser. There's a lot of different ways that we can take care of that soft tissue. Now, once we've opened up that range of motion with the joint and the soft tissue components, we need to look at motor control. There's a few different ways that we can fix these, but generally with neck pain, we find that the deep neck flexors and the middle and lower traps are weak or not doing their job. So those upper traps are tight and the pecs are tight and they're holding you in this position here. So we're gonna give you a couple exercises to fix those. Let's go take a look at those. To work those deep neck flexors, we're gonna start by laying on your back. You wanna think of giving yourself a double chin. Hold that position as you lift your head off the table. And we're just gonna do holds here. Now you really should feel this underneath the chin here. So when we're in this position, you're gonna tuck your chin as you lift your head off. Most people are gonna have a tendency to jut the chin out as they do this. We really wanna keep that tucked so you feel these muscles under here working, elongating your spine. And you're gonna do holds upwards of 30 seconds, even upwards of a minute with this. For the middle and lower traps, we're gonna do what's called a YTWL. So you're gonna put your arms into the position of a Y, and then I want you to think of pulling your shoulder blades down towards your back pockets. So my left shoulder blade is gonna go towards my right back pocket, right shoulder blade is gonna go to the left pocket. From here, we're gonna squeeze those down and back, move your arms back slightly into a T position, squeeze down and back, move into a W, squeeze down and back, and into an L, squeeze down and back. You wanna make sure we're not flaring the ribs out like crazy with this. Keep those locked down, and then rinse and repeat. Squeeze down and back, squeeze down and back, squeeze down and back, and squeeze from there. And you can do anywhere from 5 to 10 reps for a couple sets of this, and you should really feel it in those middle and lower traps, a little further down on the shoulder blades in the back. These are a few of the general exercises we would use for neck pain, but it really depends on what your exam shows. Go ahead and give us a call to get on the schedule today so that we can tailor the approach to you and you no longer have to deal with cookie cutter approaches that just aren't cutting it.